Okay, so I'm Clay Prince, Dr. Clay Prince. I'm a family physician here in Rexburg, also Chief Medical Officer at Madison Memorial Hospital. Just wanted to say a few things for our community about COVID-19 and the pandemic that we're currently preparing for. Specifically about testing, there's been a lot of testing talk out in the media and on social media that we're watching, and I know a lot of people are worried about it. And right now, it's also really, really important that we try to prevent contagion, not just of COVID-19, but of all kinds of respiratory illnesses. So right now, if you're sick, it doesn't really matter if it's COVID-19 or not, you really need to be isolated from other people. And so that's one reason why we're asking everybody who's sick to stay home for 14 days. Do not expose yourself to anybody. We want contagious illness of all kinds to be limited, to be stamped out, and to not be spread around in our community, just to help us make sure that all of our healthcare resources are online and in place in case things get kind of rough with this epidemic that's going across the country right now.
My name is Dr. Jack Clark. I actually wear a few different hats in the community here. I'm the hospitalist medical director, as Dr. Prince said. I also am medical director of Madison Carriage Cove, and I work up on campus at the BYU-Idaho Student Health Center. So I see healthcare in several different arenas. And one point that just want to drive home is that testing doesn't prevent the disease. You could be tested today, and a week later, you could be exposed to someone. And with the limited numbers of testing nationally, it's more important that we isolate, that we keep ourselves and others protected. If it's a mild illness and you're wondering if you have COVID, yes, we're all wondering that, but unfortunately at this point we don't have the ability to test you, and testing would not change what we recommend. We would recommend that you go home, that you take care of yourself, that you isolate from other people until you're no longer running fevers and until your cough is better.
So I know right now there's a lot of buzz being generated about newly available drive-through testing at a hospital in Idaho Falls. We think that's great that that's being set up. I think it's important for everyone to recognize that even with that being newly available, patients will still need to have a prescription from their physician to be able to get tested, and they'll still need to meet the same criteria for being tested, meaning they'll still need to have the suspicious symptoms. They will still need to have had a known contact with a person who has known to have been tested positive for COVID-19, or they still will need to have had a history of having traveled to an area in a foreign country that's endemic with COVID-19 right now. So just because there's drive-through testing now doesn't mean that everyone will need to be tested. They still have a very limited number of tests that are available through that.